and it was really a great honor and a great pleasure. You know, I've practiced for 12 years. I've had the honor of seeing literally thousands of patients and evaluating thousands of patients. And it was really a unique experience to get to evaluate Mr. Trivedi. And the results, which we're going to go through in a minute here, were just really mind-blowing. And, I expected that things were going to be different with Mr. Trivedi, and he didn't fail to impress me in that way. So on November 8th, just a few days ago in Scottsdale, we performed this chiropractic evaluation of Mr. Trivedi. Mr. Trivedi's age right now is 49. And so the first thing we're going to look at are his x-rays, and we're going to be comparing these x-rays with other x-rays of males from the ages of 19 to 50. So in this evaluation, things that we looked at is we looked at his spine, we looked at the intervertebral discs. What was really impressive with Mr. Trivedi is the lack of degeneration that he had in his x-rays. Seeing thousands of people as people age, like tooth decay, what tends to happen is that people decay and degenerate. And we see almost no evidence of degeneration in Mr. Trivedi. And we're going to be looking at those x-rays in a minute, and I'll show you exactly what I mean when I say that. So also some things that we'll be talking about, his density of his bones and his tonicity. Just some really interesting stuff that we'll talk about. So the technologies that we used and the different things that we evaluated, we used digital x-ray in my office. We have a technology called SEMG. I'll talk about that a little bit when we look at that. Thermography exam was performed. I did digital palpation of Mr. Trivedi's spine and his muscle tone. We did active range of motions test as well as a postural evaluation. So the first thing we're going to look at here is the comparison of his lateral cervical spine. So this first slide that you're looking at is Mr. Trivedi's x-ray on the right-hand side and an x-ray of a typical healthy 19-year-old on the left-hand side. Now, the things that you look at in this type of x-ray is you look for signs of decay and degeneration. So in a healthy spine and a 19-year-old, and this x-ray over here is no exception, a typical 19-year-old will have a healthy x-ray that we're looking at. Now, what you see is you will see, typically you'll see a healthy curve in the spine, and that curve should be slightly forward. It's what you see actually in Mr. Trivedi's x-ray. The other things you're going to look at is vertebral bodies. So the arrow on the bottom is showing you his vertebral bodies. And what you should see with his vertebral bodies is they should be nice and square. They should kind of look like ice cubes. And then above and below the vertebral bodies, the space in between those are the intervertebral discs. And normally, what you should see is nice healthy space in between those intervertebral discs. The other thing that we're looking at here is the C1 vertebrae, which is the very top bone right up beneath his skull. And what you should see in the C1 vertebrae is there should be a healthy space between his skull and his C1, and that should be open and equal to the space between his C1 vertebrae and below that. So this now is an x-ray of a 25-year-old. And there are some changes that you start to see happen in a 25-year-old's x-ray in terms of decay and degeneration, which is typical at this age. One thing you see is that the spine tends to straighten up. So this person's spine is getting very straight. If you look at the vertebral bodies, you'll notice that they're now not the nice square shape they were. They're actually starting to do what we call bone remolding, which is early signs of decay and degeneration. You'll also notice in this subject's x-rays that his C1 vertebrae is now very compressed towards the skull. So there's some changes going on that are indicative of interference and indicative of some degenerative changes going on with this subject here. In Mr. Trivedi's x-rays, again, 49 years old, we see none of the signs that we see in the 25-year-old's x-rays. So in the 31s, again, we just see continuation of some decay and degeneration going on. What you're noticing with the vertebral bodies now is they're just getting more flat, they're getting more narrow, and you're seeing less space in between the discs. Okay? In this case, you see also less space in that C1 vertebrae. Now we get to 41-year-olds. What you're going to notice here is now we're starting to see some significant decay and degeneration. So in the lower arrows that you see, what we see is the bones are seriously remodeling, and you also see that there's much less space in between the discs. Okay? So this is some advancement of decay and degeneration. This is very typical of what you'll see in a 41-year-old. In fact, the subjects that I picked to compare Mr. Trivedi to were all people who are what you would call relatively healthy person. If you were to see this 41-year-old, he's the picture of what you would call perfect health. Very well-built man, has obviously taken very good care of himself. But what you see on the outside isn't necessarily what's going on the inside. And Mr. Trivedi's x-rays demonstrate this impressively. And then the last slide we're going to look at here in terms of this view is a 50-year-old patient. And you can see now that there's just significant decay and degeneration going on with his vertebral bodies. They're not square-like at all. The space in between the bones almost doesn't exist anymore. If this is ignored and neglected longer, this is where we start to see bone fusion occur, and some serious problems can persist after that. So we're going to look at the A to P view, which is basically a forward view of the x-rays. So again, this is the 19-year-old. And what we're looking at is Mr. Trivedi's x-ray on the right, the 19-year-old's on the left. The things that we look at here is that we should see just good alignment of the spine. Basically, the head should be in alignment, the shoulders should be in alignment, the spine should line up in a straight line up and down. And that's what we see in Mr. Trivedi's x-rays, that's what we see in this 19-year-old. Okay, so what we'll see here in the 25-year-olds, if you look, you can start to see that there's unleveling going on with his 25-year-olds. His shoulders aren't level anymore, and we're starting to see that his head is actually slightly starting to tilt, which is typical of what we see with most people at this age. So in the 30-year-olds, we just see continued progression of degeneration going on. Again, the spine's just not lining up the way that it should be, and the head's, for lack of better terminology, is not on straight anymore. So a 40-year-old, typical 41-year-old's x-rays, again, this 41-year-old is pretty straight here. And then you can see this is a typical 50-year-old's. Lot of decay and degeneration going on now. Really, for me, I've never seen a 50-year-old, 49-year-old client come in or in that age range with Mr. Trivedi's x-rays that we see. If you were to ask me just to look at his x-rays, I would probably guess that he's in his early 20s. So we're now going to be looking at Mr. Trivedi's low back and his pelvis. So this, again, is looking at this from forward to back. And this is a typical 19-year-old. What you should see here is that the pelvis should be level. So the two bones, the big bones that you see on the bottom there, should be level. And then the spine should line up in a straight line like a tall building. Okay, that's what we see in Mr. Trivedi's x-rays. In this 19-year-old, his bones line up a little bit more like a Leaning Tower of Pisa. The other thing that was very unique about Mr. Trivedi's x-rays, and I've never seen this on x-rays before, is that we can actually see Mr. Trivedi's bone muscle density in his x-rays. So if you look at the x-ray on the left, that's normally what you should see in terms of the bone. And you'll notice that you don't really see any muscle at all in his x-rays. Mr. Trivedi's x-rays actually show his muscles. And the only reason that can occur in an x-ray is because his muscle density is different than that of a typical subject. So again, I've done thousands of x-rays and I've never seen this before, actually. So this is a 25-year-old. And again, what we start to see here is we start to see some signs of decay and degeneration, some more unleveling of the spine. This is a 30-year-old. Again, you'll just see more and more that the spine is becoming unlevel. The ilium, which is the pelvis, is becoming unlevel. Okay, and this is that 41-year-old. And this one is particularly interesting because if you were to see, again, this 41-year-old in person, you would see that physically he's a very muscular man. And you would expect if you were to see density on an x-ray, he's the kind of person you would see that on. And we see no evidence of density at all in his x-ray in terms of his muscles. Again, different story with Mr. Trivedi's x-rays on the right-hand side. Again, you can just see the clear difference between these two x-rays of a 50-year-old, a typical person in a 50-year-old range, and Mr. Trivedi's x-rays. So the lateral lumbar view is going to be the side view of the x-rays. What we're looking at here, what I might point out, is the lack of decay and degeneration that we see in Mr. Trivedi's spine. So this is a 19-year-old healthy spine that we see on the left-hand side. And what we're seeing on the right-hand side is a Mr. Trivedi's 49-year-old healthy spine, which actually looks healthier than the 19-year-old that we chose here. And what you're going to notice here is that you will see the remodeling of the bones. Again, instead of that nice square shape, you're going to see that they start to look a little bit messy looking, and the space in between the bones becomes less and less. So you'll see that with the 25-year-old. You'll see more of that with the 30-year-old. Again, in the 41-year-old now, we see the flattening of the vertebral body, which is signs of decay and degeneration going on in the body. And in this 50-year-old client, we see just very significant now decay and degeneration going on. And this is typical of what we'll see in a typical client at the age of 50. And then the next x-ray we're going to look at is AP open mouth. And the reason we're just pointing out this x-ray is because really what we're seeing is a perfect alignment of Mr. Trivedi's upper cervical, which is his C1 cervical and his C2 cervical. It is rare to never that you see these aligned this well, and very, very, I mean, I've never seen an example of it in a 49-year-old. So surface electromyography is the next test that we did. So what this test measures really is the communication between the brain and the body. Surface EMG is the same technology as the EKG. So an EKG is the heart monitors that we're all used to seeing, maybe on the doctor's shows, the ones that go beep, beep, beep. And what a surface EMG is measuring is the electrical impulse coming from your brain, down your spinal cord, out your nerve, into your heart. What we see on the left is what a normal surface EMG should look like. What we're looking at are the white lines. That's measuring that electrical signal coming from the brain, out the nerve, into the body, in this case, particularly into the muscle. And what you should see on a standard test to make this simple for you is white lines, and there should be good symmetry. Mr. Trivedi's scan is on the right-hand side. And some interesting things that we saw with Mr. Trivedi's scan is in the neck, what we saw is very normal readings. Now, it's very uncommon that anybody comes in with normal readings at all in this test. What I found so interesting about his test is that in the bottom part of his scan, we actually saw activity going on, more than you would expect in a normal person. What's interesting is that he has perfect symmetry. And with what I saw in his x-rays, where we saw so much density in his muscles, my feeling with this is that the reason we're seeing this significant difference here is really because his physiology is that much different. If you look at the next x-ray, what this shows us is that he has almost perfect muscle balance. The arrows are indicating difference in resting muscle tone, and whites are in the normal range, and green is very mild. Now, these scans, what you see with muscle tone is that these should shift throughout the day. So a perfect scan wouldn't be somebody that just has nothing going on here. And Mr. Trivedi's scan here is just as ideal as you can get when you look at these types of tests. So, summary of our results. We saw his spine x-rays were comparable to that of a 19-year-old. Little to no degeneration in his cervical and lumbar spine. He has an ideal position of his first cervical vertebrae, ideal alignment of both his cervical and lumbar spine. He has normal lordosis in both his cervical and lumbar spine. Lordosis is that curve forward in the neck and the curve forward that we look for in the low back. Abnormal density, which is very high in his pelvic muscles. And then he has ideal alignment of his pelvic bones in his x-rays. He had an ideal cervical range of motion. Again, something that you rarely see. Sometimes I see that in my teenagers when they come in. And he had thick, supple muscles, both in his cervical and lumbar spine. So I've palpated thousands of people's back and spine, and I've never felt anything like I felt in your neck. It was quite unusual and really quite exciting because it was, the motion of it. And I work with bodybuilders, and his muscles are more plump and taut than you see on these big muscle guys. So it was really an honor and really something unique, and just different. I don't know how else to put it. The testing showed different results, but when you feel him, it is just different. Is the only word I can come up with right now.